One of the other questions that is often asked is, can treatment of hepatic encephalopathy ever be discontinued? Uh, Patient is being treated currently with lactulose or rifaximin, and they're tired of taking the medication. They've been well controlled for a long period of time. Can you ever stop that therapy? And again, the short answer is no, but I'm going to explain, a little bit more. And so I think it starts out with, first, who do we treat for hepatic encephalopathy? Well, in patients with covert encephalopathy, that subclinical condition, we really don't offer treatment for those patients, most likely because it's difficult to recognize. If recognized and becomes more overt, then we would offer therapy. We also don't treat patients just with cirrhosis to prevent the development of the first episode of hepatic encephalopathy. So that primary prophylaxis is not something that we do. But once someone has developed hepatic encephalopathy, regardless of what the precipitating factor was, whether they were constipated, dehydrated, infected, had a GI bleed, took some medications that led to this. Once they've been started on therapy, and therapy again is usually either lactulose or rifaximin or a combination of the two, you really cannot stop. When patients stop, they're far more likely than to have yet another episode of hepatic encephalopathy, land in the hospital, and all the risks associated with being in the hospital. So we do not stop therapy in these patients. And so it's important that these patients be followed up closely by their physicians to make sure that they are taking their medications, that they haven't run out, that there isn't a problem with any type of prior authorization or actually uh, getting that medication. With each episode of hepatic encephalopathy, the brain recovers almost to baseline, but not completely. So the more episodes of hepatic encephalopathy, the harder it is for the body to recover, and that's actually reflected even after liver transplantation. So when do we stop medications for hepatic encephalopathy? We stop them after transplantation, because after transplantation, uh, you have a new liver, which is normal, and the patient doesn't have a risk anymore for hepatic encephalopathy. But studies do tell us that the more or the greater number of episodes of hepatic encephalopathy before transplantation leads to less of a recovery of a complete mental status afterwards. And so, once again, very important. Once someone has had an episode of hepatic encephalopathy, we don't stop treatment. We just continue it up until the point that the patient gets a liver transplant. And so, once they start, they're pretty much on it until that point. Thank you.